to introduce everybody, but I'm delighted that you were all able to make the seminar this afternoon, which is fantastic. We've got a couple of speakers who I'll introduce in a moment, and then we'll have plenty of time for Q&A after that, before we wrap up at the end. So just to note, and we put it in the chat, this seminar will be recorded, so we just have to let everybody know that. So if anyone's got any objection to that, if they could mention that in the chat now, or as they say, forever hold your peace, that would be great. And I just hope everybody can hear me okay. Super. Great. So we're going to, it's a real pleasure to introduce you to our speakers today. So we have with us Dr. Rachel Uthred, who's the Managing Director of an organisation I know some of you will know of, Oxford Measured. So this is a boutique education consultancy, and Rachel's got a lot of experience. Many of you will know her on assessing programmatic impact and education effectiveness. And Rachel was the co-author of UNESCO's Institute of Statistics Handbook on Measuring Equity in Learning, which was, again, a paper and handbook I'm sure many of you have come across. We've also got Anita Riley, who is the Girls Education Challenge Teaching and Learning Specialist and discussant. She is a former teacher in teacher training, and she has been for a long period of time been associated with the Girls Education Challenge, and she is specifically supporting projects in the Girls Education Challenge in the Horn of Africa. So welcome you both. Thank you ever so much for taking the time here today to present us with the findings of the GEC-T baseline learning levels. So I'm just going to give a very quick recap on the Girls Education Challenge. So maybe we'll have the first slide. For those of you who don't know, the Girls Education Challenge started in 2012, and some of you may know that I have a personal interest here, as I was involved with the team that set up the Girls Education Challenge that long while ago, nearly a decade now. As you probably know, that was at the time the largest donor-funded girls' education programme in the world. And since 2012, the GEC has supported 41 projects across 17 countries, and you'll see the map there highlighting where the projects are. Phase 2 of the GEC began in 2017, and that will run through to 2025. The GEC transition projects, or GEC-T for short, support up to 1.32 million marginalised girls. And this programme, as you know, is all about transitioning. So continuing to learn and transition into secondary school or further education or work. And then there's also the Leave No Girl Behind programme, which supports other projects focusing on highly marginalised adolescent girls. So today we're very much focusing on the GEC transition projects, as you know. So with no further ado, I'm going to welcome and hand over to Rachel, who will walk us through some of the findings. So over to you, Rachel, and thanks again for coming.
Thanks so much, Sally, and thanks everyone for joining today. Really nice to see the names popping up there in the chat and lots of names that I recognise, so hi to everyone. As Sally has introduced, this is the baseline analysis of GEC-T data sets that was undertaken by Oxford Policy Management in partnership with Oxford Measured. And our team member names are here on the slide, and we have a couple of people from the team joining also, may be able to answer any questions that you might have at the end. So the content that we're going to cover today includes a background. Sally's already given us some background there, the methodology that we used in this project, and then the presentation of the specific methodologies and the findings for paper 1 and paper 2. So the background to this, as Sally has said, is that there's phase 2 of GEC. with one, the GEC transition window, focused on supporting girls to transition from primary school into other further education, secondary education and vocational training, and the Leave No Girl Behind project that is targeted on catch-up projects for 250,000 highly marginalised girls in 10 countries. The background to this particular piece of work is that at the time of commissioning, and this was pre-COVID, FCDO held these large baseline data sets and baseline, sorry, we've just flipped from the presentation to somebody's camera. Perhaps if everyone could turn their cameras off, then we'll make sure that everyone can see the presentation. So at the time of commissioning, FCDO held a large set of baseline data sets and evaluation reports for the 27 independent GEC-T projects. And they contained really valuable information around the characteristics of the GEC-T girls, their learning levels and the barriers that they face in attending school, performing well and transitioning into secondary school or vocational training. It was identified that the combined analysis of these data sets really had the potential to contribute significantly to our understanding of marginalised girls and education. The scope of this work included producing a set of papers on key themes through the analysis of this existing data across 27 GEC-T baseline data sets. And the focus of this presentation is on 2 of those papers. It's really quite light touch given time constraints, but the 2 papers are available and we'll share the links for those if you'd like to get some more of the detail. The methodology overall included reviewing baseline evaluation reports for the specific evaluations of each of the projects across GEC-T projects to understand how beneficiaries were targeted and what the sampling strategies were for specific evaluations, combining these data sets into one master global data set, conducting descriptive and regression analysis on those on that data, and then supplementing with other sources of data to understand some of the observations that we were seeing within the data itself. And that included key informant interviews with program implementers. There were some limitations. The comparability across projects was not the primary focus of the baseline data collection exercise. So as a result, comparability was not always present across all of the indicators within the data sets, particularly learning. And how the samples were drawn for each project was quite different and in some cases quite complex. So the data set as a whole at the global level is not representative of GEC-T girls. But despite these limitations, the dataset does provide us with really useful information about the diverse range of girls who are supported by GEC-T projects. So the first paper, who are the GEC-T supported girls? So using actual data, so this is representative. GEC-T projects support over 1.3 million girls in 27 projects across 15 countries. And by region, we can see the vast majority are in Africa. This reflects the location of projects themselves, not just the size of projects. When we categorise the girls by the countries they're in and the fragility status, we see that just under a third are in highly fragile countries. But not all projects operate in the areas of the countries that are highly fragile. So for example, in Nigeria, there are projects both in the south in Lagos and also in the north in Kano. So while all of those girls would be considered in this analysis within highly fragile countries, not all of them are specifically affected by that fragility in the same way. We looked at the targeting and we found that projects tended not to approach targeting of the girls in terms of filling specific quotas. So none of the key informant interviews that we conducted were any of the implementers indicating that there was a certain percentage of girls that they wanted to be girls, mothers, disabled, out of school, for example. It was also clear that some projects were not solely responsible for targeting. They worked in collaboration with other groups, including government and community members, sometimes both. And that at times there needed to be trade-offs because the conceptualizations of what makes a girl marginalised were not always shared by all stakeholder groups, and trade-offs needed to be made in order to ensure that the project could continue to operate. So what does this data tell us about the characteristics of GEC-T girls? Now we're moving to the data set itself, which, as I said, is not representative, but does provide us with information about the diversity of GEC-T girls. So the majority of the girls in the database, the vast majority of the projects themselves focus their activities on girls who are enrolled in school. So there was a very small percentage of GEC-T girls who were out of school. And this is the nature of the way in which the GEC-T projects were established, focusing on support to girls in schools, which was a slightly different approach to phase 1 projects. This is why we see fewer out-of-school girls in the GEC-T rather than previous projects, for example, the step change window in phase 1. Predominantly due to this shift in providing support through schools, many projects used a whole school approach rather than supporting specific individually targeted girls. But also part of this that came through the key informant interviews was that many projects did experience targeting challenges. Many of the girls are overage for their grade. So if you look at the blue part of this graph, this is the age of the girls. We can see that the range is from 6 years old through to 23 years old. And the majority, the average girl is 14 years old. So that's where we see the peak of this distribution across this graph. Then what you see there in the red line is the proportion or the percentage of those girls who are over age for grade. So it makes sense that we see at the younger end of this graph that it's 0 because a girl who's 6 and in school hasn't had an opportunity to be over age for grade yet. And then once we get to 18, 17, 18, by the nature of their age that they're still in school, 100% of them are over age for grade. But if we take the average situation there, our average 14-year-old, almost half of them are over age for their grade. Most of the girls have both their mother and father alive, and they live with them. About 14% of them are single or double orphans, and a very small proportion are married or mothers. The highest percentage of married girls is in West Africa at about 6.4%, and the lowest in Asia at 0.6%. And this high incidence in West Africa is partially due to the targeting strategy of one particular project, Mercy Corps, where 22% of the girls within their program that are supported are married. Importantly, most of the GEC-T girls are learning in a different language than they speak at home. So as you can see from the graph here, almost 70% are learning in a different language than what's spoken in the home. What's really important here is that around a third of the girls, their primary caregiver does not speak the language of instruction. So it's not only that it's that it's not the main language in the home, but the primary caregiver in about a third of cases do not know the language of instruction. And over 10% of girls do not speak the language of instruction. All of the projects administered the Washington Group set of questions across these 6 areas of functionality. And what emerged from this was that across all of the different areas of functionality, the reports by girls, we had much higher proportion of girls reporting both some difficulty and a lot or complete difficulty significantly more proportions than primary caregivers gave. We found that quite interesting, so we did a little bit more analysis, and what emerged was that actually there was very little crossover between the primary caregivers who were reporting functional difficulty and the girls who were reporting self-reporting functional difficulty. So I guess what emerges here and what the implication is that there is both, as with all categorizations of disability, that the Washington group questions are not entirely reliable, but at the same time that the way in which they are perceived, these different, both the categories themselves and also what levels of difficulty girls have in these areas may be perceived differently by different stakeholder groups. Many of the GEC-T girls have difficulty affording education. Over half of them. These 6 questions were asked to all girls, to all primary caregivers across all contexts. And this was the biggest difficulty across these 6. It did reveal that there were cultural variations in the way that some of these questions were conceptualized or perceived. So, for example, being unable to meet basic needs without relying on charity was really interpreted differently in different places. On one end of the spectrum, it could be perceived as borrowing money from a family member, and on the other end of the spectrum, it could be actually being the beneficiary of an established charity. The majority of primary caregivers for GEC-T girls did not complete primary school. So we have here the head of household and the primary caregiver responses. In some cases, where it's a single-headed household, they may be the same person, and in other cases, they may not be. What we can see here is around a third, around a third of the girls, the primary caregiver and or head of household has no education at all. Around a third has undertaken some primary education, but it's incomplete, and around a third have primary school completed or higher. We looked at all of these things that we've discussed so far in this presentation by region and FCAS status, and we didn't find that these differences were very straightforward. So GEC-T girls in West Africa were more likely to be overage, severely overage, pregnant or married, or learning in a language that is different to the main language of the household. Less straightforward was around fragility. We observed that girls within countries with high fragility actually were better off than those with low fragility, and fewer girls in FCAS countries reported economic difficulties when compared to neighbouring countries. Some of the explanations for this are, as I said at the beginning, that this category of fragility is quite a blunt tool in terms of who's captured in that and the different situation of girls within a fragile country. Secondly, a possible explanation is that there are different perceptions around how specific things are inferred in the questions, and also, for example, there could be projects that are supporting displaced communities in neighbouring countries. And potentially it is easier to target more marginalised girls within more stable contexts. So for paper 1, some of our analysis finds that the GEC-T girls experience disadvantage in multiple ways. More than half of the girls in which more than half of the households in which the girls live have difficulty paying to send girls to school. Most of the girls are being taught in a language that they don't speak at home, and many do not have a caregiver who's able to speak the language of instruction. Most of the GEC-T girls' caregivers have not completed primary school. The percentage of out-of-school girls, married girls, and girls who are mothers is relatively low, and this is predominantly explained by this shift to focusing on whole school approaches and supporting girls within schools. It was difficult for implementers to target girls with disabilities, And this was in part because in working with schools, there is already a lower proportion of girls who are disabled within schools than out of school, for example. Moving to the GEC-T girls' baseline learning levels and predictors of learning. In order to answer the research questions, we conducted a global literature review around the evidence base and what the predictors of learning are, so that we were able to compare the predictors of learning across a whole country population groups to the specifics of marginalised girls. And we go into a lot more detail on that in the papers and less detail in this presentation due to time. We then looked at the measures of literacy and numeracy that were developed for each of the GEC-T projects, and we developed learning benchmarks around what needed to be, the girls needed to be able to do in order to meet a minimum benchmark based on SDG 4's indicator of achieving a minimum level of proficiency in maths and in reading. Then we conducted a series of analysis around the relationship between reaching these benchmarks and individual school and country level characteristics. And then we conducted the same analysis, but with specific within country data sets where we were able to use much more fine-grained learning data rather than the proficiency level benchmarks where it's either meeting the benchmark or not meeting the benchmark. There were limitations to this approach. The assessments, as I said earlier, were not designed to be comparable across the portfolio. And for this reason, one of the major contributions of the paper are the predictors of learning for marginalised girls rather than the learning levels themselves. And we go into a lot more detail on that in the paper, so please read if you're interested. And another limitation or something to be aware of when looking at the findings here is that we're really talking about associations that are purely descriptive. There's no causal relationship here. These are baseline data sets where no intervention has taken place yet, and we're looking at the relationship between learning and other characteristics. So overall, the percentage of girls who are meeting benchmarks, we found that almost 50% were not meeting either benchmark for reading or maths. We have about 25% reaching the quite low benchmark of maths but not reading. Fewer, almost 9%, meeting the reading benchmark but not maths, and then around 22% meeting the reading met both benchmarks, reading and maths. Then when we move on to looking at the predictors of learning, this first set of predictors that I'm going to present are based on the global analysis. This is a regression that we did across the global database using the benchmarks. So sorry if we can move, thank you. And in this regression, again, these are not causal relationships, but we're looking at the unique contribution of a set of predictors to meeting, first of all here, the mathematics benchmark. The things that you see below the grey line represent a negative correlation, and those bars that go above the grey line represent a positive correlation and association. Any variables that did not have a statistically significant relationship with learning within the regression did not appear in this output. So what you see here are statistically significant findings, and then the size of the bar indicates the effect size. So what we see here is 3 negative predictors. The language is different to, language of the home is different to the language of instruction. The teacher using shouting in the classroom. The primary caregiver having no education negatively predict meeting the mathematics benchmark. Positive predictions include the number of safety hazards that girls experience on the way to school, girls reporting chores affecting schooling, and age grade status. So the age grade status here is probably the easiest one to explain, in that girls who are older are likely to have greater cognitive development due to their age. And we have a very low benchmark that they need to meet here. So this is really related to both age grade status and I would say age itself. The number of hazards on the way to school is an interesting finding. Again, we're talking about association, not correlation. Not causation. One of the potential explanations is that in a community where there are a lot of hazards on the way to school, that perhaps many girls aren't going to school, and the ones that are more able. Girls reporting chores affecting their schoolwork. Again, this could be related to age. We know that as girls hit puberty and beyond, that the expectations and the domestic burden increases. If we can move to the next slide. On reading, we have a different result. What we see here is a little bit perplexing, that now we have the opposite, a large negative correlation and prediction of girls reporting chores affecting their schoolwork. We have very small negative correlations with the teacher using detention and using physical punishment. Again, we have this age grade positive predictor that is likely to be explained by age itself. And the teacher using shouting and the language being different to the language of instruction are also interesting and unexpected results on the basis of these being, but also small for those two small effect sizes. So important to think about the extent to which what they're telling us, and also the extent to which they should inform implications. But we weren't entirely convinced by these results that we were getting a complete picture. So we then turned to running the same regressions, project by project. We focused on this project level analysis because it could provide us with a clearer picture, because the learning measure used within projects was comparable, and therefore we could use the fine-grained learning measurement rather than a yes-no benchmark that was not entirely comparable across projects. What we found when we ran this project by project, and then we mapped it across the different predictors, we found a huge amount of variance in the extent to which some characteristics and behaviours predict reading and mathematics proficiency. Age and overage status predicted learning in both positive and negative directions in different projects and for different subjects. Interestingly, whenever physical punishment was found to have a statistically significant relationship with learning, it was always in a negative direction. And this wasn't always true for other teacher behaviours like shouting or using detention. The role of the primary caregiver emerged as significant. The primary caregiver having no education negatively predicts reading across most projects. Girls reporting that chores affect school usually negatively predicts learning. Reporting at least one functional disability negatively predicts reading and mathematics in both projects, with the highest and the lowest proportion of girls with disabilities. So always moved in the negative direction. And reporting an increased number of economic barriers at the household level negatively predicts both maths and reading in several projects. So by using these fine-grained learning measures, we saw a much clearer picture emerge, and that was the important relationship between learning and poverty, between learning and gendered social norms, between learning and disability, and learning and the use of physical punishment in schools. So our reflections on the implications for this were that for GEC itself, were that projects should sensitise communities on gendered social norms and education, but also provide targeted support to those girls who have high domestic burdens. And secondly, that projects should not only focus on eliminating physical punishment in schools, but should also focus on building the capacity of teachers to develop alternative strategies. Teachers need more than one tool in their toolkit, and need to have pedagogical approaches that move away from classroom management styles that use fear in order to manage the classroom activities. So thank you very much.
Great, Rachel, thank you so much. That's fascinating. So I think we'll move on now to Anita, and then we can open up for questions. So over to Anita.
Great, thanks, Sally. Can everyone hear me okay?
Yeah, fine. I can hear you fine.
Perfect. Great, and thanks, Rachel, for that presentation. That's really, really interesting. So I'm just going to outline some of my reflections and some of the considerations for girls' education programming and the wider education systems, and then this additional complexity that COVID-19 has added to some of these predictors of learning that Rachel outlined. So if we just move on to the next slide. So this visual here outlines some of the predictors of learning and retention at the level of the girl, at the level of the home, and then the level of the school. Obviously, before pre-COVID, there were many intersecting factors that meant GEC girls were more susceptible to being excluded from learning, such as poverty and disability. And in many cases, what we're seeing now is the pandemic has amplified these factors. So let's just take a look at overage first. And this wasn't a predictor of learning, but a negative predictor of learning. But paper 1 does outline that there's a large number of GEC-T girls that were overage for their grade. So we have over 30% 2 or 3 years over their grade, and then 10% that were severely overage. That's 4 or more years. And we know that overage means that a learner or a girl is more susceptible to dropping out early. Now, in this current context, girls are going to be even more overage. And of course, that's going to vary across contexts, but many more will be in the overage category, and those that were overage more will switch over to the severely overage category as they've missed a year of schooling or more. And we already have projects reporting that some of the girls are now married, and this is also linked to economic constraints at the household level, using marriage as a coping mechanism, which I'll come on to also. So this has many implications for schools and projects. Firstly, it's essential that there are inclusive re-enrollment and retention strategies in place, and this will include schools working closely with community stakeholders to ensure that there's attendance and retention systems. And then in some cases, projects may also be considering and are also considering supporting girls on alternative or support pathways, such as accelerated education programs or catch-up programs. Then the rest of the factors here are the factors identified in paper 2 that negatively predict learning outcomes. And if we take disability pre-COVID, many GEC projects were supporting children with disabilities to learn, and also working with families, with communities and schools to help, especially to help ensure positive attitudinal changes concerning disability and concerning inclusive education. What we've seen as schools closed due to the pandemic, there's evidence that the learning gap is widening between girls with disabilities and their peers. And many girls are disproportionately affected by school closures, as they have increased barriers to accessing learning opportunities. Many ministries have rolled out distant learning modalities that are not accessible to all learners. For example, radio may not be suitable for those with hearing impairments or those with additional learning needs that benefit from the support of teachers or learning assistants within schools. So there's many considerations for projects for this and implications, but two of the main ones are the need to support the remote learning of learners with disabilities. So, for example, one project in Kenya has community facilitators that conduct home visits and work closely with parents. And then the second implication is the need to close the learning gap at the school level as schools reopen. And this may be through remedial support, for example, again, as many GEC projects are doing, or catch-up support. At the level of the household then, as Rachel outlined in the baseline analysis, We found that not speaking the language of instruction in the home has a negative impact on girls' learning, and for 70% of the girls, the main language spoken at home is not the language of instruction. So if we think of what this means for remote learning has generally been rolled out in the language of instruction. Not in all cases, of course, it varies across contexts again, but there are two big challenges here. First, if the caregivers don't speak the language of instruction, they'll be less likely to provide that academic support to girls. And then secondly, for girls who are not fluent, they can no longer use these in-school coping mechanisms, such as visual cues or body language. They're not able to work with peers in their local language. They cannot benefit from the support of teachers or teachers switching between the official medium of instruction and the local language. So that's a large disadvantage for these 70% of girls. And then there's also this link between caregivers having little or no education themselves. As learning has relocated to the homes, if parents don't have an education themselves, they're less likely to be able to support home learning. But it should be noted that they can support, if they can support girls academically, there are other ways that they can support girls motivationally, or providing them with radios, or just carving out the time for their learning. So projects have had to find ways of ensuring support for these girls, such as home visits or learning in small groups where possible. And as with any disadvantaged group, assessing learning levels when girls return to school will be important. And this is also for learners with disabilities. Then we have the factors of heavy chore burden and poverty that were also identified as predictors of learning. And again, the pandemic has exacerbated these factors. The chore burden and limited resources are closely interlinked, and they link to poverty. And we've seen that the pandemic has worsened household poverty levels in many cases. And we see families are prioritizing survival and deprioritizing the learning of children. And across the GEC projects, girls have reported increases in domestic workloads or the need to work to contribute to household income, all of which we know negatively impacts on learning. Projects are also reporting that households are struggling even more than before to meet the costs of schooling. And of course, this is going to impact negatively the most disadvantaged. And as I've already said, some are resorting to coping mechanisms such as early marriage. And this intersects with girls now being older and more over age. What projects are finding, for example, in Uganda and Nepal, is there's a very close link between supportive and engaged parents and girls' continued learning. So projects are working closely with parents to ensure that they're engaged and supportive of girls. And projects are also working with communities on activities like village saving and loan groups, and helping households meet the costs of girls' schooling, for example, by providing scholarships, covering transport costs, providing learning materials, etc. Then finally, we have the school level factors of teachers, if they're shouting or using physical punishment as a form of discipline, it negatively impacts on learning. Of course, it's widely recognised that children cannot learn well if they're fearful, and there's this important relationship between emotional well-being and the ability to learn. Now, worryingly, GEC projects have reported increases in sexual abuse, in gender-related violence, and in early pregnancy and marriage during the pandemic. And they've also reported increases in anxiety levels of girls and stress levels. And this is often linked to increased levels of household poverty. So it's more important than ever. Of course, it's always important, but now it's more important than ever that learning environments are safe, are nurturing, and are healing. And as well as focusing on teaching and learning throughout the pandemic, projects have also prioritised girls' safety and well-being. The protective role of schools is more important than ever, as is the mentoring role of teachers. So it's vital that safeguarding protocols, reporting mechanisms, referral mechanisms are in place. And as well as that girls are getting support needed, such as counselling. So if we just go on to the next slide. So just to wrap up, here are some of the considerations for projects and school systems that I've touched on briefly. UNESCO have estimated that 11 million girls globally risk not continuing their learning due to COVID-19. So it's a huge number, making it vital that those most at risk are identified, are reached, and are supported. So to avoid widening the learning gap for the most disadvantaged, it's more important than ever to identify girls most at risk of not learning. And to do this, the factors that negatively impact on learning need to be understood and mitigated. And projects have been doing situation analyses to interrogate the unique needs of various groups of girls. So knowing the predictors of learning is important, and this baseline analysis helps guide some of our thinking on that. And finally, then, it's key that all the enablers of learning, such as holistic and emotional support, teachers knowing the level of their learners, programs to support learners, such as catch-up or remedial, are all widely promoted where relevant. Of course, this will vary across contexts. So yeah, there's some of my reflections. I think I'll leave it there and pass back. Is it to Sally?
Great, thank you, Anita. Really, really great to get that sort of first-hand information on projects going through the pandemic to complement Rachel's excellent discussion about the nature of the girls supported, and some really interesting insights there. I mean, I've got lots of questions, but I'm going to not ask them. I'm going to open up to everyone on the call. We've got a great number of people on the call. So I'm going to ask if people wouldn't mind, because it would be great to have as much interaction as we can, because we all know that's a good way to learn. If people could put their hands up with that little hand function, if you can get that to work, so we can get people actually asking the questions, that would be great. We have got Caroline and Elisabetta are also monitoring the chat. So if there are questions coming up there, then we'll be able to address some of those also. But it would be great to have people coming in directly, so we can have a sort of conversation as much as we can in these difficult times and doing this virtually. So I'm just going to pause for a moment for people to raise their hands. If you're finding that function difficult, just please come in on the chat to say you'd like to come in. Right, I've just found a flaw in the technology, because I have seen a hand going up on the 91 and I can't see who it is. So please come in.
Hi, Sally, it's Emily Gray here.
Super, Emily, come in. Lovely to hear you.
Thanks. You too. I'd be really interested to hear a bit more about this challenge around targeting the most marginalised girls in fragile and conflict-affected states. I know in terms of the time you had for the presentation, you had to skim over that a bit, but it'd be great to have a little bit more info on any lessons learned there and anything else that's been pulled from the data around that. It would be really useful for my current work as well as knowledge generally. Thanks.
Great, thank you, Emily. Does anyone else want to come in? Because we can take a group of questions. So maybe Rachel, do you want to come back on that one, and anything else you've got to add, then Anita afterwards?
Sure. So that's a really interesting question. It's one of the reasons, one of a few reasons why we added the key informant interviews as part of the methodology, because what we saw emerging from the data, obviously with quantitative analysis, it doesn't give us the answer to the why questions. Why are we seeing this emerge? How did this happen? So the information that we have comes from key informant interviews with implementers and a sample of those. So our understanding is that this issue around targeting was that, for example, targeting disabled girls was specifically raised as very challenging in conflict-affected countries. A lot of implementers reported that it was very difficult to find disabled girls because they were hidden within communities, and other targeting difficulties were reported also. There's a little bit more information on that within the report itself, but a lot of this information, of course, comes from implementers themselves. So there's an opportunity within GEC, if this hasn't already taken place, to discuss these things across projects also.
Thanks, Rachel. Anita, did you want to add anything?
No, I've nothing to add, Sally. Yeah.
Great. Thanks. So, Caroline, you were going to just bring in a couple of comments from the chat. Yeah. That would be great. Thanks.
Sally. So there's been some discussion about disability and the Washington Group questions in the chat. So the point was raised about reliability of the Washington Group questions versus self-perception, and maybe differences in how people or people view themselves, or how caregivers might kind of understand those questions and what the perception might be. And again, there was also how stigma and discrimination could affect those perceptions came up. And I apologize to Lorraine, Penny and Pauline if I'm not doing justice to your points. So do come in if I'm not. But Pauline also made a point about whether girls' own reporting might be the more reliable one. I had wondered, and again, Rachel, I'm not sure if this is something you're aware of, but like, are there studies which look at the kind of how the Washington Group questions are verified, or differences in reliability depending on who reports them? So I might leave or put that to you, and then come back with some more points from the chat, but just as there's a few points on that. Thanks.
Thanks. Yeah, thanks, Lorraine, for raising this. I know we had a couple of conversations on this during the process. This was a while ago now, pre-COVID. I mean, you're absolutely right that these issues around self-perceptions come into it. I guess from a statistical perspective, the reliability is low when we look at it across the girls and their caregivers, and we, as I said in the presentation, don't just observe lower reporting by parents, but actually a mismatch between which parents are reporting difficulty and which girls are reporting difficulty. So I'm sure that some of this is around self-perceptions. I'm sure that some of it is around stigma, as has been raised by Penny. I think if it was entirely explained by stigma, we would see less prevalence reported by caregivers, but more of a match between which caregivers and which girls are reporting. The lack of this overlap is the part that I think says there's something else going on as well. It's not just stigma. And I think also, Pauline, we discussed this internally and with Lorraine as GEC's disability expert, that that it is correct to rely more on the girls' self-reports than caregivers. But this is a really tricky area for all researchers, I think, and it's something that we're struggling with globally, and not just in the area of girls' education.
Great, thanks, Rachel. And before Caroline comes in, I've got a question, if I might pop it in, because I can't see many of the little hands popping up. But please don't be shy, people. It'd be good to hear from you. So, I mean, certainly on the COVID response, Anita, I think the GEC has, picked up some really nuanced qualitative data just through your sort of quarterly reporting and discussions with people in the field. Lots of people I know on this call actually who are directly working with those girls. And obviously there's an awful lot at the same time of very global quantitative data and assumptions around the impact of COVID on learning, on children, how, and I just wondered whether there was any plans to bring those two together a little bit, so to be able to look at, what globally as an education community we're saying about the impact on of COVID on learning, but specifically this group of very marginalised girls and at different ages, and just be interested whether there was plans going forward on bringing those two together, because I think there's a unique set of data there that's from the Girls Education Challenge that one won't get necessarily in other contexts. So I'd just be interested in that, but save that one for the end because that's more my set of interests. Yes, so any other questions? There was a couple more in the chat, I think, Caroline.
Yeah, so on overage, Daniel asked about how this might have different interpretation across the projects, that in remote places girls might get into school later and be a higher age before they complete their basic education. So just to put that question to Rachel and Anita, and I had one related to that, maybe more for Rachel, which was in the graph where we saw the kind of how girls became overage across their ages, and there seemed to be a spike at age 9, and I was wondering if this was just maybe a bit of variation in the data, or if there was any kind of thinking about what that might be. And there was one other question in the chat related to age. So Joseph asked about how the targeting was decided. Was it specifically to target ages 10 to 18, or if that was just a sample? And just being aware that some data and assessment data suggests gaps in learning emerge early. So by the time girls are around age 10, there might already be disparities. Thanks.
Thanks. Really interesting questions. On the overage and differences across contexts, we did actually look at the policies across different countries in which these projects are being implemented. We looked at what the official policy was, and then we created the overage categories based on whether they were overage against the official policy. So there may be some contexts where a girl could be in a particular grade at a particular age, and she would be considered overage in some projects, but not in others. So it is aligned to the expectations of the national government for that analysis. The issue around the spike at age 9, we do actually have Alistair on the call, who was responsible for that analysis. And Alistair, you can jump in if I'm saying anything that's incorrect. The spike at age 9, I don't think that we really uncovered anything that explains that. It could potentially be simply a lower overall number of girls that's created that spike, but that's something that we can look into in the data and see whether there's anything emerging from that. I can't give any explanation kind of off the bat. How the targeting was decided based on age, well, different projects targeted in different ways. So we find, for example, in northern Nigeria, there was a very large, in West Africa, in Nigeria, there was a very large program that was targeting adolescent girls. And so they ended up with a sample of girls that were tended to always fit the overage category because they were usually 18 or above. Like I said in the presentation, had kind of 22% of the girls were married. And then there are other projects where, for example, they've chosen to use as their strategy exactly this issue of addressing learning early before the learning gaps emerge, where they may have chosen to work in an early childhood setting or at the early grades of primary school. So then most of the girls within that project, and therefore that project database, would be 6, 7 or 8. So these age categories correlate very strongly with the projects themselves and what strategy they're taking, whether they're trying to address these learning gaps before they emerge, or whether they're looking to mitigate these gaps after they've happened.
I was just going to say, in response to Daniel's comment on overage, thinking programmatically, it depends a lot on that school context and the policies at the school level. So if it's quite normal for a 21-year-old to be sitting in a classroom of 15-year-olds, then there isn't as much stigma, or the girl won't be as uncomfortable. But if she is the only 21-year-old in a class of 14, 15-year-olds, then that's much more of an issue, and she's much more at risk of dropout.
Great, thanks both. There's a question from Emily in the chat. There's also someone with their hand up if they wanted to come in. Sorry, I can't see names. You pop your hand up if you could come in, that would be grand.
Sorry, that was me. Sally, it's Emily.
Oh, Emily, great, come in.
Sorry, my question's in the chat, which was just about the fact that this is the baseline, which I assume was done some time ago, and that we would expect to sort of learn more about subsequent surveys, midline, endline, and that lots of the GEC transition projects, I assume, are coming to an end. I'm a little bit out of touch, having been involved in that stage of the GEC. I'm keen to see where we've got to with the subsequent sort of progress for these girls. Great to know where they were at in 2016, 17, etc. But good to know what do we know more about the progress they've made.
Thanks, Emily. So the midlines have pretty much been completed. Some have been impacted by COVID, but most were before that. So some of that is reflected in the latest annual report for the GEC. But we have, I think some of them are on the line. Some of the independent evaluators are already working on the large evaluation of the GEC, and that will include some looking at the COVID impact and also making use of the subsequent data sets. As is ever the case, we're never in real time with this type of research, but it's on the way. There was just one or two more questions in the chat. I know we're coming up to the final minutes, but just not to have ignored anyone's points. I missed a point that Amy made about the impact of the assessments for children with disabilities if appropriate adjustments were made. There is another point Colin made about whether any investigation was made or could have been made on the direction of the associations. And also Sadia and Maureen mentioned the impact of the chore burden. So what was that impact? And Maureen came in mentioning time and stress and the expectations. Again, if final minute, if anyone has anything else to say on that.
Yeah,
otherwise,
so thanks, Caroline. I agree. We need to keep. So basically, we can keep all the questions. So we can certainly come back to people with more detailed responses if need be. But I'm conscious of time. But if Rachel or Anita, you just wanted to give a very quick, you can follow up on my point separately. But any couple of points just on those, but otherwise we can respond to people afterwards. So Rachel, maybe for you first, and then we'll go to Anita.
Sure. Yeah, I'll keep it really quick. I think an important one to note is this appropriate adjustments for children with disabilities or functional difficulties during the assessment. It's a really, really difficult area. In a different, with a different hat on, I have worked with providing support on assessment to evaluators, and for GEC it's particularly challenging because you may have girls with a whole range of different disabilities or functional difficulties, and adjusting an assessment to be able to be administered to girls with such a different range of difficulties is very difficult. GEC has made some really important attempts at doing that, where other projects might just say, this is difficult, let's exclude the disabled girls. So appropriate adjustments have been made whenever possible, but are absolutely imperfect because it is just so difficult.
Thanks, Rachel. Anita, any final comments from you?
I was just going to comment on the heavy chore burdens. Yes, I agree with the comments. We are seeing worse chore burdens for girls, and this negatively impacts on learning, especially for the most marginalised. Key has been working closely with parents, or in Leaving a Girl Behind projects, for example, working with husbands or partners of girls as well. For those, again, Leaving a Girl Behind projects, a lot of those have non-formal or alternative programs for girls, and key has been for girls to decide themselves on the timetabling of those projects. So that helps alleviate some of the issues around chore burdens.
Great, thank you both, and thanks everyone for joining. Look, I think there's, as been pointed out, this is the first sort of look across all of the projects and all of the girls involved, and obviously we've got the midline and the end line coming. So that's going to be fascinating, and particularly obviously the impact of the devastation of COVID and schools being shut and all of that implication we'll be able to pick up. So I think, just to reiterate my point, great sort of source of lesson learning, I think, for the broader education community. So really keen that, that we integrate that with the broader information that's coming out, because it's really great to be able to have that really close relationship with the groups of girls that you're supporting through this project, which is fantastic. So thank you, Rachel, thank you, Anita, and thank you everybody for joining. There was a lot of you on the call. I hope you found that useful. We will follow up with some of the questions, and if you didn't feel you got your answer, but take care, everyone. And for all of those who have joined from remote places, thank you so much for all the work you're doing in really difficult circumstances. It's fantastic. And take care and have a good rest of the week. Thanks very much. Bye-bye, everybody.
Thank you, Sally. Bye, everyone.